Greetings, my name is Janet Schulte. I'm a critical care paramedic. I currently work at Lindenwood University, which is a 4-year bachelor's degree program, and I teach in the paramedicine program. I also do a lot of American Heart Association things, and I've been working with the American Heart Association over 40 years. I know, I started when I was 6. Anyway, what I'm here to do is to just kind of overview a little bit about the PALS program and to put you at ease that you can't not pass the program. We have job aids for you, and we have the cards from the book. You can use these during your scenarios. It has the Braslo tape on it. We're going to have some of these emergency cardiovascular care books in the stations. If you wish to purchase one, you certainly can. You also have your PALS book, and what I recommend you do is to, by all means, go into the inside where it says go to, there we go to this website and to do the student pretest. Now you can do the pretest as many times as you want, which is a great thing, because just keep doing it. It has 3 sections: ECGs, it has medications, and it has a putting it all together. Now you might have had ACLS, Advanced Cardiac Life Support, maybe not by the American Heart Association, but it's very similar to that, very similar. We're going to be working on shock, respiratory, and cardiovascular scenarios. And the big difference between PALS and the ACLS is it's weight dependent. So you pretty much have to know the weight, and that's where the Braslo tape comes in. You're not expected to memorize all the dosages because of the weight, but you are expected to know how to look it up. Now, another thing that we're going to go ahead and give you is going to be one of these, which is the PALS systematic approach: evaluate, identify, and intervene. And I highly recommend that you really go through this, because what's going to happen is all the scenarios that you will be doing are based off of this. So if you go from the top and go all the way to the bottom, you're not going to miss any valuable information. And all the scenarios that we use are basically set up the same way. Now for testing, you need to pass a written exam with 84%. It's 50 questions, multiple guess. And as far as testing out, you will be tested out on 2 scenarios as a team leader. One will be a cardiovascular one, so it's either the heart rate's too fast, too slow, or not there at all. And another one will be either shock or respiratory. So we're going to be practicing those, and you'll have plenty of time to ask questions. Now with this PALS systematic approach, the first thing is your initial impression. So when you see the mannequin, of course the mannequin is the mannequin, but you need to ask, what does the patient look like? What is their work of breathing? What is their skin color? And we can give you all of that as instructors. I will be there, and also we have 2 other instructors, Gilbert and Shay, coming over from the other islands, and identify the problem. So at that point, you don't have to necessarily tell one of us this, but you know, you need to develop a concept. Do you think it's respiratory? Do you think it's cardiac? Do you think it's shock in origin? And it could be more than one thing also. Now, it says intervene with any treatments for any life threats. So if you do find that they're not breathing, or you find out that, you know, there is no pulse, that's a life threat. So you'll probably treat for life threats, and that's probably as far as you're going to be able to go. Now, as far as evaluate, for your primary assessment here, you want to look at the airway. Is it patent? What is the breathing rate, effort? What are the breath sounds? Circulation, you know, what's the heart rate? What's the capillary refill? Disability, and we have ABPU here. Are they responsive, alert, verbal, painful, unresponsive? And then exposure. That's important because with a mannequin, you're not going to see anything. You're not going to feel a fever or anything, warm shock or cold shock, but you'll need to ask. So at that point, when you undress them, you say, I'm going to expose them. What do I see? We can tell you. And then at that point, what you do is you identify the severity of the problem. If it is respiratory, are they in distress or are they in failure? Cardiac, are they stable or are they unstable? Shock, are they in compensated shock or are they in hypotensive shock? And then you need to intervene with appropriate treatments. Now, your secondary assessment, you're going to do a sample history, and that's signs and symptoms, allergies, medications, past medical history, last meal, events leading up to the presentation. You also want to do a physical examination, and that would be your neurologic, from head to toe, go down and find out if there's any medical issues, find out if they have any trauma. And then at that point, what you can do is identify the problem. So if it is respiratory, is it an upper or lower airway obstruction? Is it a lung tissue disease? Is it a disordered control of breathing? Cardiac, is it an arrhythmia? Too fast, too slow, what's going on? Or could be cardiac arrest. Shock, what type of shock? Hypovolemic, distributive, cardiogenic, obstructive? And all this is in your book. And then you want to intervene with appropriate treatments. And at the very bottom here, it says there's diagnostic tests. These aren't necessarily at the bottom so that you do them last. It's more or less whenever you are looking at the patient, you determine in that clinical situation that, hey, I need some labs, I need some blood work, I need x-rays, I need a CAT scan, I need other tests. You can certainly ask for them. So the other thing is to read your book, to go through your respiratory, your cardiac, and your shock cases, and to be familiar with them. And we're there to help you. We're there to, help you pass. And so, you ask questions, we'll answer them. So I hope this was helpful. Thank you very much. I'll see you soon.